Hi, good afternoon. I am Dr. Samira Saadun Al-Hassani, Fellow of Royal College of Surgeons of Edinburgh. I'm Fellow of Royal College of Obstetrician and Gynecologists, and I have the interest in health, healthy lifestyle since 1996, when I did have a small stroke, but I cured, and I'm very deep in the healthy lifestyle. I practice healthy lifestyle and teach it. I do it as charity, free, no charge, because I feel I have to give back to the people who helped me, supported me, and gave me freely. So now this session is, of course, my channel is started 5 years ago in COVID time, and there are many videos about health of gastrointestinal tract. And why I started with the gastrointestinal tract, because all diseases start with the gut and the leaky gut, and there are videos in celiac disease, inflammatory bowel disease, irritable bowel disease, and colon cancer, and how we could prevent it. And there are videos, is food, 2 series, can food prevent colon cancer? And it does. It can, if we eat healthy food and if we eat fibers, and we know what is microbiome. And there is also a video about microbiome 5 years ago, and about sleep and about anger, and it is still valid scientifically, but there are a few changes. For example, in the microbiome, when I started 5 years ago, the scientists, they thought the number of the microbiome is an organism inside the colon, consists of bacteria, viruses, archaea, parasites, and viruses infecting the bacteria, which is called bacteriophages. And it is a world ecosystem, and some people, they give an example of a garden or the forest, rainforest. And this is very essential for our health, because this microbiome, it digests the food and produce chemicals as a poo of the microbes, and this is very, very healthy for us. For example, short chain fatty acid like butyrate, propionate, acetate. And propionate, it is a material which is researched about, and it is very good for the energy of the colonocytes. And what is colonocyte? Cyte means cell, the cell which are lining of the colon. So if the cell lining of the colon become healthy, then there will be no leakage of food and toxic material through the intestinal wall into the blood. And the gut, it is considered the first brain or the second brain, because it is very rich in nerve cells and in nerve fibers. And the microbiome inside the colon, it trains the immune system, and it has a great connection with the mental health and psychological health, and the health of the central nervous system, and the health of the immune disease. And this means, if we look at our health, or after our health, gut health, then we will have healthy mind and healthy brain and healthy immune system, and we could even prevent autoimmune diseases which affect a large number of people in the world nowadays. If our immune system is healthy and does not attack the self. And this is another story, how the cells of the immune system learn or trained in the thymus, which is here, how to differentiate between the self and non-self. It's just like studying in a college. And if the cells, they don't know the self from the non-self, there is an automatic program, a command to die. And this death is called apoptosis in Latin. The cell, if it doesn't know self from non-self, then it has to die, because if it go inside the blood, it will destroy the body. This is how effective is the immune system. And of course, recently there is treatment for cancer, which is called immunotherapy. They teach the immune system of the patient with cancer about these cancer cells, and then the immune system of the patient will attack the cancer, even if that cancer is spreading all over the body, especially melanomas. And a good case, which is famous, is the President of the United States, Carter. Of course but then he retired, he went to his farm, and of course he's white skinned, and he exposed himself to the sun. But this is not against the sun, no. Even white people, they could expose themselves to the sun in a gradual way, and they have to do it, especially in the morning, when there is not much ultraviolet rays and the blue light. This is another story about the light and the sunlight, which is very, very important now, the sunlight for our health. But anyway, Mr. Carter, he developed melanoma and metastasizing to the liver and to the brain. But when they used this method of immunotherapy, he was cured completely. And there is another doctor, which is called William Lee, L-I-E, and he has 2 books about diet. His mother is a professor of music, and she developed carcinoma of the endometrium, which is meaning the cancer of the lining of the womb. And her son, he examined the microbiome, and he find that there is bacteria deficient in her, which is Akkermansia mucinophilia. This bacteria make the mucus, and it is 5% of the number of the microbiome. And it is increased by eating pomegranate, cranberries, and the food which is red and purple in color, and olive oil, organic, and cold pressed. But this good bacteria, if it is increased, say 15% or 20%, then this is not good, inflammatory. Everything in the body is balanced. Temperature should be balanced, blood sugar should be balanced. The body is working very well, or it will work in balance, and it is called homeostasis. Homeo from home, stasis means stable, stasis. Okay, so this is an introduction to my English speaker, which I left them for a long time, and I'm sorry for that, because I was working hard to educate my Arabic subscribers, because they are very interested in my work, and they encouraged me and they supported me, and I'm very grateful for them. So now I'm going to summarize this book, which is Mind Over Matter. This book is started or published in 1995. It is an old book, 20 years ago, but I bought it recently, and it is written by two PhD, Dennis Greenberger and a woman, Christine A. Badisky, PhD. They started a therapy or treatment which is called Cognitive Behavioral Therapy. Therapy means treatment. Cognition means thinking. Behavior, behavior. So this treatment, it depends on restructuring our thoughts, because the thoughts, it will affect our behavior, and our behavior, it will affect our life, and at the end, our health, mental health and psychological health, spiritual health, and physical health. And in Arabic, we have a saying, العقل السليم في الجسم السليم, meaning healthy mind is in the healthy body. if the body is healthy, especially if you do exercises. And this is a proven exercise is a treatment against dementia, Alzheimer, depression, mental diseases. And I'm glad I go to the gym and I see many cases of with mental health issue, schizophrenia, or they come to the gym to do exercises. But of course they don't do it like us, but at least they move their body. And at least they come every morning. And this is very good move. So this mind, it is a book which is consisting of I think 12 chapters. The first 8 chapters, yes, 12 chapters. 12 chapters. And the first 8 chapters is about clinical cases. So they take a case from the beginning and then we go with them, follow up through the chapters. How they treat the patient, how the patient improved. Number 10, it is understanding depression. Number 11, understanding anxiety. Number 12, understanding anger, guilt, and shame. Okay. So how they treat the patient? They treat this patient by the patient see therapist. And there are charts, and in the chart there are columns, and at the top of the column they write words. And I'm going to teach you in a very simple way, and I hope. And this treatment, it is not only for mentally sick cases or psychologically sick patient, but for all of us. It will help us in our daily life. So, and the case is Ben. Ben, he became retired and he think he is old and he start to get depressed. He has a daughter and a son. They are married. He has grandchildren. He has a wife. But he went to visit them and saw them. They are busy. They did not pay too much attention. So he started to think, I'm not useful, I'm useless, and so on. This is Ben. Then, so the environment here put the thought, the mood, the behavior, the physical reaction. It is all how you react to your environment. Okay. Then there is Marisa. Marisa, this is the most difficult case because she was sexually abused in childhood by her father. And she could not tell her mother because she told her mother and the mother did not believe her. Then she become, at the age of 16, then she can't stop him. Then she started to work. She got married, she has a child, then she got divorced. She was married again and she has a child and she got divorced. Then she started to have depression and thoughts of suicide. Okay, this is Marisa. And then this is the name written in the book. So how to understand Marisa's problem. Then we have Vic, which he said, help me to be more perfect. Vic, he is alcoholic and he go to AA, which is Alcoholic Anonymous. They treat him for his addiction. So one night in the evening, he told his wife, I'm going tomorrow, Saturday, to this meeting. And the wife, she did not say any word, but she changed the body language of her face. And he immediately got angry and he hit the table. Then he left the house, he closed the door with force, and then he took his car and drive where? He went to the bar. But luckily he stopped. He did not go to drink. He got his notebook because the therapist gave him a notebook and he started to write. And I'll tell you what we write. Okay, and then we have also Linda, which get frightened when she go in the airplane, and she start to think, she starts sweating, flush, her blood pressure, her pulse rise, and she start to feeling fainting, and she thinks she is having heart attack. Fear, and this is phobia. Many people, they have fear or phobia from flying, some from lifts, some from going outside the house, some from height, from blood, from needles when you give them injection, and so on. And this is, they get panic attack. Linda, we spoke about Linda, Vic, Ben, and Marisa. And then we will go through the book. So the book, it is consisting of tables. And this table is divided like this. So the first page, if you look at the top, it is situation. Situation means who, what, where, and when. The next to it is mood, and you have to answer it in one word. Then A and B. B, you give it a number from 0 to 100. Then the automatic thought, and what is going in your mind before you feel this mood. And then you have to circle the most important thought. This is in the first page. In the second page, we have to write our thoughts which support our negative feeling. And when we write our thought, we are allowed to write it in sentence. Okay? Many sentences. Then you put full stop, then you start in. Then you start to have a column, the evidence that does not support your hot thought. The most important thought, for example, in case of Marisa, is suicide. She said, so what is the thinking which support this thought? And then what are the evidence which does not support your hot thought? You can write many thoughts. Then you summarize it into one sentence. You put it at the end, one sentence. And you connect the evidence with and, or. Then the other column, which is alternative, from this evidence you could create alternative thought or balanced thoughts. And this is A. And B, write how much you believe in this alternative, or what is your belief, because the belief is very important in this thought, the new thoughts. Then write your mood now. For example, if you put you are sad and you put 80%, after writing down your automatic thoughts, you circle your hot thought, you put evidence with your hot thoughts, then you put evidence that against your hot thought, and then you reach an alternative or balanced thought. Then what is your mood now? It could be 50%. But with time, it will be reduced to 20%. Now, this is an example how the tables are filled. See? How many columns? 3 columns in the first page and 4 in the second page, so it is 7 columns. This is the book. This is to teach the patient how they think. It is very, very important, because the thought, this patient or these people, could be not patient, they believe in their thoughts. What cognitive behavioral therapy, we have to be above our thoughts, because thought is just energy going through the brain. We human, we are more than our thoughts. And Plato, the philosopher, which is great, and Western civilization built on his teaching. The teaching is of the idea, or logos in Latin, and from which is the logic. And logic is to make sense out of nonsense. Because life is chaotic. Life in a case of entropy. Entropy, this is a word in physics. Life, it's a lot of signals and problems and a lot. So how the brain can make sense out of this nonsense. So this book is a training to the people, and they teach them how they write what they think. Of course, it is long book, and in Arabic I translated almost word by word, and it took many lessons. But in English, I try to make summary, because you can buy the book. It's very cheap because it is old, and you could read it and understand it. Or you could borrow from their libraries. I think it will be available. Okay? So, and of course, with the teaching, for example, we take now a case and give you an example. I'll discuss Marisa because she is the most difficult. So the therapist, she told her, I understand your thought, record correctly, but your whole thought was, the pain is so great that I have to kill myself. You were able to find evidence to support that thought, but you were unable to find any evidence that did not support this thought. Then Marisa, she said, that's right. Then the therapist said, have you ever felt in the past that your pain was so great that you had to kill yourself? And she said, yes, dozens of times. She teach her, this is not the first time you have this thought, and then you get out of it. So the therapist, she said, in the past, when you have felt this way, what you have done or thought which help you to feel better? So Marisa, she said, it is funny, sometimes talking about my pain helped me feel better. So therapist said, talking about it helps. In the past, have you ever thought about anything that helped you to feel better? Marisa said, when I'm feeling the worst, I try to remember that I have felt this way before and I have gotten through it every time. So it is not the first time. So the therapist said, well, it is important information. Is there anything about your situation now that suggests that suicide is not the only option? So Marisa said, what do you mean? Therapist said, I'm wondering whether or not you have any hope that something other than suicide will lessen your pain. Marisa, well, I guess I'm learning to think differently, but I'm not so sure that is going to help. The therapist, part of you is doubtful about whether the cognitive behavioral therapy will help you, and part of you is hopeful. Marisa said, yes, I am much more doubtful than hopeful. So the therapist said, percent-wise, how much of you is doubtful and how much of you is hopeful that the skill you are learning will help you to lessen the pain? So Marisa said, I am 90 to 95% doubtful. And 5% hopeful, because her case is very difficult. So the therapist, we will keep a track of how your level of doubt and hopefulness fluctuate as you progress in the therapy. If you told your best friend, Kate, that the pain is so great that I have to kill myself, what would she say to you? Marisa said, I never would tell her. But if I did, she probably would tell me that I have a lot going on for me. And she is working, she has children, a lot to look forward to, and a lot to contribute to the world. I wouldn't believe her, though. She doesn't believe. Because these people, they have negative thoughts about themselves. They feel they are failure, they feel they are not good, they feel they are useless, they feel life is not worth living. So the therapist, would she tell you anything else that you might partially believe? Marisa, she would probably point out that there are some things in life that give me some enjoyment, that I have some moment during most day when I feel better and in less pain. She would remind me that something strike me as funny and I laugh occasionally. So the therapist, if Kate told you that she was experiencing severe emotional pain, now she teach her to detach from herself, and the patient become observing her friend as a patient. So if Kate told her that I was experiencing severe emotion and thought that suicide was the only solution, what would you say to her? So Marisa said, I would tell her to keep trying other solutions. There would have to be hope for Kate. But I don't see much hope for me. The therapist, she said, well, consider how much hope makes sense in a few minutes. First, let us write on thought record the things we just talked about that go in column 5. So Marisa in column 1, who? It is about herself. What? She was at home alone. And it was Saturday, 9:30 p.m. The situation. Who, what, when, and where. Okay? Then the second column, mood. What did you feel? A. B. Rate each mood 0 to 100%. So she wrote depressed 100%, disappointed 95%, empty 100%, confused 90%, and real 95%. So she is very high grade. That's why she think of suicide. The column 3, automatic thoughts, between this is Arabic word, between brackets, images. A. What was going through your mind just before you started to feel this way? Any other thoughts, images, these questions. B. Circle the whole thought. What she wrote, these are sent. I want to go numb, so I don't have to feel anymore. The second thought, I am not making any progress. 3. I am so confused that I can't think clearly. 4. I don't know what is real and what isn't. Then the pain is so great that I have to kill myself. And this is the whole thought. So she circled it. Then nothing helps. Life is not worth living. I am such a failure. Okay. So now we come to the column, the evidence that support the whole thought. I am so empty inside. I just have to die. The pain is unbearable. Killing myself is the only way to get rid of the pain. All thoughts. I have tried many types of psychotherapy, many therapists, and many medications which haven't helped. Then the evidence that does not support the whole thought is empty. Empty. So now we come to the other sessions. The evidence that support whole thought, we read it. What are the evidence that does not support whole thought? She feel it. In the past, talking about my feeling sometimes helped me feel better. See, this is the first 3, and then this one, number 5. I read it. 2. I have felt suicidal and in severe emotional pain in the past and have gotten through it every time. 3. I am learning to think differently, which might help, although I'm doubtful. 4. Kate sees me as having positive qualities and a lot to contribute to the world. 5. Some days I feel better and in less emotional pain. 6. I laugh occasionally. So she starts to learn how to feel it. You see, once we write, we become more clear in our thoughts. And so on. The same with Linda, Ben, and Vic. Every case they teach them how to think and how to fill the chart. And with sessions the therapists start to build positive thinking. They increase the ability of these to understand that they need to think positively. For example, in the case of Vic, when he went to the bar, he did not drink, he wrote, then he came back home. And then he started to talk with his wife. And he told her, he thinks that his wife doesn't like him, she doesn't care. And he told her, that's why I'm angry. She told him, when you told me I will go Saturday to the AA, I remembered on Saturday is my sister's birthday, and I didn't send her a card. So in the book he said that her husband read her brain or her mind. He read her mind without her permission. She is thinking about her sister's birthday, and he is thinking she made this face because she doesn't like him, she doesn't care. Although when he wrote in the chart the evidence to support his whole thought, she doesn't like me, she doesn't care, she doesn't want me to be sober from alcohol. And then when he come to fill the column, the thoughts which is against his whole thought, he says she loved me, she used to go with me to the AA, she's very good all her life, she stuck with me for years. So she has many good things. Okay, so, and the same with Linda, because with the therapist, she went to the doctor when she feels she is going to have a heart attack, and they check her heart and it is normal. So they told her this sweating, redness, flushing, feeling dizzy, it's not heart attack. It could happen with anxiety and panic attack. So she started to understand it is not only when she is in the airplane. Sometimes this attack started even in the house before she take her car to the airport, or even when thinking about airplane. So it means that the problem is related to the thought. It is not to heart attack. And that is how they teach the patient to see reality. Okay, so this is an idea about the book. It is very good. And then we go through to the depression. Of course, the depression should be mild or moderate. If it is severe, these people, they need antidepressant drug, and then cognitive behavioral therapy. And of course, also, if you expose your body and your eyes to the sunlight, it is antidepressant, and it is proven by research is as effective as antidepressant for mild and moderate cases. Also, exercises. Because during exercises, the brain will secrete hormones, and even during exposure to the sunlight, which will make us relax and feel better. I think I should stop, and perhaps if you want more, you just comment, and I will go through it in detail if you want. But the second book is How to Control Emotion, which I call it Emotional Intelligence or Emotional Maturity. The main point in emotional intelligence is when there is a trigger, we have to take a pause, then we respond. It is not when the trigger comes, we react. No. We have to take our time to think, choose how to respond, and there are many options. Sometimes you don't need to respond, you just keep it quiet. The other thing which we learn is emotion. It comes and goes in the other book. It's not permanent, and it is just a temporary state, and you are more than your emotion. And mostly, if you are mindful of the emotion, you diagnose it, this is negative, it will not help me, so it will stop. The main thing is to be conscious about your mind and mindfulness. Thank you. I wish you get benefit from this knowledge and information. And thank you. It is a practical really wisdom. It's a practical, it's not theoretical. Thank you and goodbye.